Save up to 50% on your medicine bills. Ask your doctor or pharmacist if Pharmacodynamics has a generic medicine that's suitable for you.
At this time of year, schools and creches are filled with the sounds of sneezes, sniffles and coughs, and many parents turn to antibiotics as a miracle cure. Pediatrician Dr. Hanneke Haynes wants to ensure parents know how this medication works and what it's used for.
Doc, tell us about how antibiotics work in the body.
There are actually 3 ways that you can administer antibiotics. The first way is via the oral route. The second one is by giving a deep intramuscular injection into the big muscles. Thirdly is you can give the antibiotics straight into the veins of the body. Now what is very interesting is that during the first 48 hours after antibiotic administration, most of your bacteria is killed. And that is why most of the symptoms disappear. The child becomes fever-free, he starts playing, he wants to start eating and drinking again, and the parents think, it's done its job, and they stop the antibiotic. Now the problem with that is that very often they are a little group of bacteria that's still left, and they will start growing. But the problem is that they actually now remember the antibiotic that has been given, and that leads to the child developing another infection, but this time resistant to the antibiotic that has already been given.
The use of antibiotics has to be very carefully considered as it's meant for certain conditions. Excessive or unnecessary use can lead to antibiotic resistance.
So in which conditions would you consider an antibiotic when you're treating your kid?
Remember, antibiotics are antibacterial agents. They are made to kill bacteria. They're not meant for virus infections, so colds and flus won't respond to antibiotics and they don't need an antibiotic. Also, allergic conditions like asthma is not treated with an antibiotic. And the cure for a fever is for sure not an antibiotic, so it must be a well-known bacterial infection.
Antibiotics are used to treat conditions like strep throat, ear infections or urinary tract infection. Severe cases of sinus infection can also be treated with antibiotics.
So what can parents do to minimize the need for antibiotic treatment?
All those little infections that the children get, try to sit through it. If you've got a cold or a flu, it doesn't need antibiotics, you can treat it at home. Then the second thing that you can do to boost your child's immune system is make sure he or she eats healthily. Make sure the child has got a healthy 5 portions of fruits and vegetables per day, and obviously drinking a lot of water. And then try to keep your child away from an environment where there are lots of infections. So we're talking about creches and we're talking about play groups and those things. If it's necessary, we understand your child needs to go, but if he's sick, please keep him at home, not putting the other children at risk.
Children are prone to common infections like colds as their immune systems are still developing. Allow them to build some immunity and don't be too quick to use antibiotics.
When will antibiotics not work in a child?
If it is a viral infection, antibiotics is not going to work. The second thing, if the child does not get the antibiotic in, he's vomiting everything up or he's spitting everything up. And then thirdly, if the dose is wrong.
Antibiotics work effectively if used with the correct dosage instructions. Follow these precisely and ensure your child finishes the course.
If there was one message that our parents can take home from this, what would that be?
Try to limit the use of antibiotics, live a healthy lifestyle, and try to treat your child at home. And if you're not sure, consult your doctor.
Next time your child is ill, speak to your doctor about your treatment options. With correct treatment and love from mom and dad, your little one will be happy and healthy.
If your child is on antibiotic treatment, it's important to follow the dosage to the letter. Don't over or under-medicate with the antibiotic prescribed. Make sure you check your storage instructions. Finally, and most importantly, make sure that your child finishes the course as prescribed.
Save up to 50% on your medicine bills. Ask your doctor or pharmacist if Pharmacodynamics has a generic medicine that's suitable for you.